A little drama from the nose is not an uncommon occurrence. A large percentage of the population experiences nosebleeds at least once in their lifetime. So there are two types of nosebleeds. We have the anterior nosebleed and the posterior nosebleed. The anterior nosebleed is the kind that we see coming out of our nose, coming from an area called the little area within the nasal cavity. 90% of nosebleeds occur anteriorly, and they are very easily manageable and often clear spontaneously with the first aid done. Posterior nosebleeds, on the other hand, come from the sphenopalatine artery, and often you don't see the blood. It is felt as a postnasal drip or a feeling, rather a taste of blood in the mouth. They are more dangerous, occurring in 10% of nosebleeds that there are, and should be managed in a hospital setup. Nosebleeds come about as a result of many things, most commonly trauma to the nose, especially in children, and when in flu season and you are blowing the existence out of our noses, that also does trigger nosebleeds. We have hypertension as well, presence of tumors within the nose cavity, as well as bleeding disorders. So in the event we have an anterior nosebleed, which is very common and can easily be managed from home, what you do is you have the patient sit down and lean forward, then pinch the fleshy area around the nose for at least 20 minutes, or rather until the bleeding stops. If the bleeding persists past the 10 to 20 minutes, it's important that we seek help from the nearest health center. As for posterior bleeds, if you notice the feeling of blood within your mouth or have a postnasal discharge, and often when you open your mouth and someone shines a light, they are seeing drops of blood within your mouth, it is important that you immediately rush to your nearest health center for care by your health worker.